We have discussed different types of pneumonia, how to treat them empirically and definitively, and how to prevent pneumonia. We have also discussed how to treat influenza, and now let's develop a patient-specific plan for prevention of influenza. When it comes to influenza vaccine, there are either trivalent or quadrivalent vaccines. Trivalent vaccines have 3 strains, and quadrivalent has a 4th strain. So quadrivalent has everything that's in trivalent vaccines. We typically have 2 strains from influenza A and 2 strains from influenza B. And influenza B, we either, we include the Victoria lineage and one from Yamagata lineage. In the 2018-19 season, the CDC and World Health Organization have predicted that these are the strains that will be most likely to cause influenza. So whilst the first strain is the same thing as last year, whereas we are actually including 2 new strains, one from the Singapore influenza A and one from Colorado influenza B. And the 4th one from Yamagata continues to be the same as the last 3 years. So the CDC has recommendations for influenza vaccination. So they basically recommend that annual seasonal influenza is recommended for all persons 6 months and older who do not have contraindications. And they do not prefer any specific product. So as long as a person gets a flu shot, that's all that matters. So if they don't give preference to any specific product, because they want to vaccinate as many people as possible. So, it doesn't matter what product people get as long as they get vaccinated. Now, vaccination should be offered by the end of October and continue through flu season. Now, later in the flu season, revaccination is not recommended. Now, one thing that's specific for children 6 months through 8 years, if the patient, if the child is the first time they're getting the flu shot, it's recommended to give 2 doses, and they should be at least 4 weeks apart. Now, if the child has received 1 flu shot in the past, and it could be any time in the past, they still should get 2 doses separated by 4 weeks, at least 4 weeks. Now, if the child has received 2 doses previously, then just 1 dose is sufficient. And these 2 doses, they don't have to be consecutive. So it could have been 2 different, one of them could be 3 years ago, and the second one could be last year. As long as the child has received 2, then 1 dose is all that matters. And anybody older than 8 years of age just needs a single dose of annual influenza shot. Now, one thing to keep in mind is that it takes about 2 weeks for the vaccine to kick in. Now, there are different vaccine formulations. Live attenuated influenza vaccine was actually not recommended for the past 2 years. This year, it's also recommended. And it's only available as a quadrivalent, so FluMist is actually developed in egg. So you can see these egg icons show that these vaccines are developed in egg. And it's only recommended for patients 2 years through 49 years. Now, keep in mind that the elderly, so patients 50 years and older, and also patients younger than 2 years, are at risk of having influenza complications. And because FluMist may not be as effective as inactivated influenza vaccine, it's not recommended for those patients. But it is okay to use it in for other patients. Now, here are the list of different brands for inactivated influenza vaccine. Now, for the most part, trivalent vaccines are actually phasing out. So it was in the past few years, most of the vaccine were trivalent. Now, as you can see, this year, majority of the vaccines are actually quadrivalent. So it's actually hard to find trivalent. And I suspect that, next year or soon after, it's going to be actually phasing out. So it will be hard to find trivalent. So these are all developed in egg. Now there's also cell culture grown. So this is actually developed in the lab, so not in the egg. There's also recombinant influenza vaccine, which uses recombinant DNA technology. So it's actually use bacteria in the lab to actually grow the virus. We have a single brand, Fluzone High Dose, which uses a higher dose of the influenza strain. Now, one thing that's also important to keep in mind, recombinant also uses a higher dose, not as much as high dose, but recombinant has higher dose relative to the rest of the flu shots. So since most of these shots are developed in egg, what if the patient has egg allergy? Only recombinant influenza vaccine is considered egg-free. Now, while cell culture grown doesn't use egg, the strains that are provided to the manufacturer are derived from egg, so it's not considered completely egg-free. Now, if someone has had an allergy to egg, not the vaccine, but egg, if they've had hives, they can receive any licensed influenza, including the ones that are actually grown in eggs. Now, if the patient has had symptoms other than hives, such as angioedema, or if they needed epinephrine, they can still receive any licensed influenza vaccine, including the ones that were grown in egg. However, they should be administered in an inpatient or outpatient medical setting in case they get a reaction. They can be care can be provided for them. But allergy to egg is not a contraindication to any of the vaccines, and you don't have to give the recombinant influenza vaccine to patients with egg allergy. Now, what if the patient has allergy to a previous influenza vaccine? Now, we don't mean the egg allergy. Now, this is allergy to actual vaccine, which is considered a contraindication. So if somebody has had a reaction to the vaccine itself, they should not receive the influenza vaccine. Now, what happens in pregnancy? So inactivated seasonal influenza vaccine is indicated in pregnancy. Of course, if the patient is pregnant during the flu season. Now, keep in mind that all live vaccines are contraindicated in pregnancy, including live attenuated influenza vaccine. So pregnancy is a contraindication for flu mist specifically. In patients who are immunocompromised, it's best not to use the live vaccine. So it's recommended to use either the recombinant or inactivated influenza vaccine instead of the flu mist. Now, keep in mind that we can actually use influenza antiviral medications. So the question is, if someone is taking those, whether for chemoprophylaxis or for treatment, would it interfere with the flu shot? So administration of inactivated influenza vaccine and recombinant is acceptable. So these influenza antiviral medications may actually reduce the effectiveness of the live attenuated influenza vaccine if they are given within 48 hours before, up to 14 days after the actual vaccine. And the last special patient population that we will discuss is the elderly patients, age 65 and older. And these are patients that are at risk of having complicated influenza. So it's extremely important to make sure that we give the right flu shot to these patients. So the CDC says that any age-appropriate inactivated influenza vaccine formulation are acceptable options. This means that you should not use live attenuated influenza vaccine in these patients because it's only indicated for patients 2 years through 49 years of age. Now, one concern with the elderly is that antibody titers decline a few months after immunization, especially in adults 65 years and older. And that led to investigators studying high dose versus standard dose influenza. So that led to the product that's FDA approved, Fluzone High Dose, for people 65 years and older. And that's because in clinical studies, when they compared it to standard dose, Fluzone High Dose had 24% greater relative efficacy. And this is a randomized clinical trial. So there's good evidence that Fluzone High Dose is more effective than standard dose influenza vaccine. So, again, CDC doesn't specifically prefer this because they want you to vaccinate as many patients as possible. If you have Fluzone High Dose, you should give it to the elderly, but if you happen to not have Fluzone High Dose, you should give anything that you have. So inactivated influenza vaccine or recombinant. Now there's also, with the recombinant influenza vaccine compared to the standard dose, They actually found 30% greater relative efficacy. However, FDA didn't allow them to claim superiority to standard dose, specifically because when they looked at, this study looked at everybody age 50 and older, but when they looked at the subgroup of patients 65 years and older, they failed to reach statistical significance. So this confidence interval crossed zero. So they couldn't show the same effectiveness. And lastly, there's also the adjuvated inactivated influenza vaccine, or Fluad, which uses the MF59 component as an adjuvant. They also looked at age 65 years and older, and they found a 63% greater relative efficacy. Now, this happens to be from a small single season observational study, so it's not from a clinical trial. But still, these are options that you can use in elderly patients. This concludes this presentation.